Hi, Christian. My name's Kathy. I'm your RN today. Looks like the doctor has prescribed you some medication called tamsulosin, brand name Flomax. Have you heard of this medication before?
I have not.
Oh, okay. Well, do you know what this medication is for?
No.
So Flomax or tamsulosin is a medication that we use for people that have an enlarged prostate gland, or BPH, benign prostatic hyperplasia. So normally the doctor prescribes this when you're having symptoms like maybe you're having a weak urine stream, or you're just having to go to the bathroom quite a bit and you can't feel like you're quite emptying your bladder all the way. So what happens is this medication goes in and it kind of relaxes the muscles in your prostate and in your bladder so that it's a little bit easier for you to pass urine.
Okay.
So when you're taking this medication, you should probably take it after the same meal every day, about 30 minutes after that meal. So maybe like 30 minutes after you have breakfast.
Alright.
And if you happen to forget to take the medication, just take it as soon as you can, unless it's already the next day. Then you should just take one pill. Don't ever double up on this medication, okay?
Okay.
So when do you think you should take this medication?
After every meal?
No, not after every meal.
After
Only
breakfast.
after breakfast would be good. Just one meal a day.
Okay.
Okay, should you double up on the prescription?
No.
Okay, that's good to know. So when you have this medication, one of the things that you want to do is you want to keep it in its original bottle and put it in a place where children can't get to it. You want to store it at room temperature, and you want to keep it out of direct light.
Okay.
So where are you going to put your medication?
Away from children, in a room temperature environment, and out of light. So probably in a drawer.
Oh, that would be great. So some things that you have to be careful about when you are taking this medication is if obviously you're a woman or a child, which we know that you're not. If you have liver or kidney problems, you might want to talk to your doctor about this medication because of it building up too much in your body if you're not excreting it properly. And if you have any issues with hypotension. Do you know what hypotension is?
I do not.
That's when you have low blood pressure. So when you have low blood pressure, you kind of have an increased risk for feeling dizzy or lightheaded or fainting, which we don't want. Another thing that we have to be aware of is that if you're taking erectile dysfunction medications. Are you taking any erectile
I am not.
dysfunctions? Okay. Well, in case you ever start taking erectile function medications, you should be aware that this medication can cause a prolonged erection lasting more than 4 hours. And if that does happen, then you would need to seek medical treatment right away.
Okay.
One of the side effects that we have for this medication is issues with ejaculation. So sometimes you might have some decreased ejaculation or painful ejaculation. And sometimes you have something called retrograde ejaculation. And this is when you ejaculate and instead of your ejaculation coming out of your urethra through your penis, it goes into your bladder.
Okay.
So this is just something that's normal. It doesn't cause any negative, bad side effects. You would just pee it out the next time you use the bathroom.
Okay.
So it's not something that you have to be worried about, but it is something that I want to make sure you're aware of. Some other side effects that you need to worry about are headache, dizziness, lightheadedness, and fainting. So if you have a headache, one of the things that you can do is you can take some over-the-counter headache medicine like Tylenol. If this doesn't work for your headache, you should notify your doctor that your headache is not going away. If you have any dizziness or lightheadedness, or you feel like you might be faint, I need you to lie down or sit down because we don't want you to injure yourself if you do faint. And those are symptoms that you would definitely want to let your healthcare provider know that you're having. So what should you do if you're feeling lightheaded or dizzy?
Um, let
The healthcare provider, your doctor. Let your
yes,
doctor know.
yes.
You don't
Let
need to
the
call him your
yeah.
healthcare provider. You can call him your
Sorry,
doctor.
I blinked. I'm sorry.
It's okay. It's kind of a touchy subject. I
Yes.
understand that. What would you do if you have a headache?
Take headache prescriptions like Tylenol, but if it continues to cause problems, then you notify your doctor.
Correct. So one thing that can help when you have low blood pressure and you're feeling kind of lightheaded or dizzy is you can move around kind of slowly. Like when you're laying down, sit up kind of slowly and then sit there for a few minutes and let your blood pressure kind of adjust to your new body position and then stand up. And then if you do feel lightheaded after you stand up, you should probably sit back down or lie down until those feelings go away.
Okay.
This should help reduce the risk of you fainting or falling or something. Something else that you have to be aware of is sometimes you can have side effects that are related to signs of an infection, like fever, chills, cough. If you have any of these kind of side effects that make you think that you're getting sick, you should call your doctor and let him know or her know that you are having these side effects right away.
Alrighty.
If by chance you happen to have chest pain, or if you have that prolonged erection lasting more than 4 hours, you need to go to the ER.
Like immediately or?
Yes.
Okay.
So if you don't go to the ER and your erection lasts more than 4 hours, it could cause you to become impotent. Do you know what that means?
Not being able to produce semen?
Not being able to have an erection.
Oh, okay.
So we don't want that to happen, do we? We also don't want you to be having chest pain because that could be related to something with your cardiovascular system, especially when you are having hypotension. It could cause some problems with your heart. So if you're having chest pains, you should go to the hospital. The other thing you have to be aware of is because you do have an enlarged prostate, you want to make sure that if it ever gets to the point where you do not have the ability to urinate, you need to go see a doctor right away or go to the hospital too, because that would not be good. We need to be able to get that urine out.
Okay.
Do you have any allergies?
I do not have any allergies.
Okay, so do you know what to look for if you are having an allergic response to a medication?
Yes. Like irritated skin or red spots on the skin or like chest pain and stuff like that, because like, you know, it like
Right. So when you're having an allergic reaction, you can get a rash. You might have some difficulty breathing or some swelling in your face. Those would be signs that you need to, if you have swelling, you probably need to seek medical attention right away. But if you just get a rash or something, you should definitely stop taking this medication and let your provider know. If you were allergic to sulfa medications, I would caution you because this medication has a higher risk for an allergic reaction in people that have a sulfa allergy. And do you remember what we talked about with hypotension? If you're feeling faint or dizzy, what you should do?
lay down and take it slow.
That's correct. Good job. And what should you do if you have a headache?
Take headache medicine such as Tylenol, and if that doesn't work, contact your doctor.
Okay, so this medication can have some adverse effects and reactions with other medications. It's always important when you have a prescribed medication that you let your doctor know any other medications that you might be taking, whether they're prescribed medications, whether you're taking vitamins or supplements, or even just over-the-counter medications like cough syrup and stuff. So if you need to take some medications, it would be a good idea for you to call and contact your doctor before you take any of those medications, just to make sure that none of them are having any other side effects.
Okay.
So how do you feel about this medication?
There's a lot of risks to it, but overall, if I follow every procedure that you've given me, I should be fine.
So I just want to let you know, like with the prolonged erection, that is a very rare side effect, but you do need to be aware of it. Chest pain, that is a very rare side effect. The main side effects that you might have is probably going to be hypotension, dizziness, lightheadedness, and a headache.
Okay.
Okay?
Alrighty. Yeah.
So do you feel pretty good about taking this medication now?
Yes, I do.
Okay, Christian. Well, I just want to make sure that if you have any questions, you can ask them of me right now.
So like, what happens if, basically what happens is like, if, I'm not able to urinate or whatever, will that like end up like hurting or killing me, or like how does that work?
So if you're not able to urinate, your urine is probably going to start moving up your ureters, which is a tube that goes from your bladder to your kidneys, and it could cause some kidney issues and some kidney damage, or possibly lead to a urinary tract infection or some kidney infections.
Okay.
So we just want to get help right away so that we can relieve, and it would be quite painful.
Right.
So we get you some relief, and we'll take care of that issue right away, because sometimes when you're taking this medication, even though it's relaxing that prostate muscle, it is still going to cause it. Your prostate is probably still going to keep enlarging. And when it gets to a certain point, it might completely block off your tube for urination.
Okay.
Okay?
Yeah.
Do you feel good and comfortable about taking this medication at home?
Yes.
Okay, well, I really appreciate you meeting with me today, Christian, and thank you so much for your time. And if you have any questions, feel free to call me at the doctor's office.
Okay, I will do.
Bye.
Bye.